Hi everyone. Have you ever struggled with profound fatigue, concerns about hair loss or hair thinning, frequent nighttime awakenings, or restless leg syndrome? If you have, you might be interested to follow along in the next few video series I'm going to make, where I talk about how your body's iron stores may be at the root cause of one or all of these problems. My name is Jennifer Knox, and I am a board-certified family physician. So, starting with hair loss, it's a very common, very valid concern that I see a lot, primarily from women, but occasionally from men. So, usually a woman will come to my office and say, my ponytail size is shrinking, I'm noticing more hair in my hairbrush, in the drain, just general shedding on your clothes, etc., etc. So, first, obviously, a good clinician is going to start by getting a comprehensive physical, or a comprehensive history, excuse me. They're going to, just kind of generally assess what is the state of your health. Where are you in your kind of reproductive years? Are you perimenopausal, postmenopausal? Are you menstruating? Are you not menstruating? What are your generalized levels of fatigue? What's your nutrition like? What are your medications? What are your herbal supplements, if you take any? Those sorts of things. They're also going to look, or they should actually look at your scalp. And that's to what I'm going to talk about next applies just to sort of the generalized hair thinning, not, patches of bald or a red inflamed scalp, evidence of a fungal infection, any type of like scarring or folliculitis, infectious fungal causes, those sorts of things. This iron stores and generalized hair thinning is just that. Like a good doctor is going to look at your scalp and make sure there's nothing else going on. For instance, it might warrant a biopsy, and historically dermatologists have been the primary medical specialty that deals with hair loss, but a lot of primary care doctors are capable of at least doing a preliminary workup. So once I look at my patient's scalp and see that there is kind of a general diffuse hair thinning, or I just, if I've never seen their scalp before or their hair, like how thick or how fine it is, I just kind of take their word for it. I'm like, okay, so more hair is falling out. I'm concerned about that, just like you are. What are we going to do? I will start with some laboratory work. So if this is happening to you and you are worried about your hair thinning, it doesn't even really matter where you're at in your kind of stages of life, right? I'm going to recommend that, your clinician should or could check what's called a ferritin. So our body's iron stores are tightly regulated, and about 30% of our iron is circulating in our red blood cells, and the other percentage is distributed in the bone marrow, the liver, and the spleen. And there's a molecule that holds that iron called ferritin. It also does a lot of iron transport, but this gets really complicated. I'm going to steer clear of that. Basically, what you need to remember, ferritin is a very good marker of your body's overall iron stores outside of your red blood cells. So the key here is you don't have to be anemic, meaning have a low level of red blood cells on your complete blood count laboratory, but you can have an iron deficiency. We call it iron deficiency without anemia. And it's surprisingly common. So the reference ranges for what is a normal ferritin are kind of becoming more in flex, right? So if you're not worried about hair loss, but say you're worried about fatigue, and I can talk about that more later, a normal ferritin might be between 30 and 50. Let's say you're just worried about hair loss, like your hair's thinning. Then typically we like to see a ferritin greater than 100. So there's the dermatological literature says if hair thinning is the concern and all other causes have been ruled out, then we should shoot for a ferritin greater than 100. That said, I am going to be putting out more videos about perimenopause and menopause. If the hair thinning is what we call female pattern hair loss, and it is related to perimenopause or menopause, it definitely does not hurt to make sure your ferritin is 100 or greater, right? It's not going to hurt anything. So we're going to want to correct the things that we can correct to optimize your scalp and your body essentially to slow hair growth. And when it comes to hair loss, the thing to remember is any improvement or halting or slowing of the process is unfortunately pretty slow. So you have to work with your doctor to figure out what are the underlying causes and then come together to make a comprehensive treatment plan. So follow me for more on this.